I'd like to welcome you to the second half of my stable versus unstable. And here I'm going to go through 10 questions. Now, I'd like to welcome my Patreon members. I just set up Patreon a couple of days ago. I thought this would be a good alternative if you cannot afford a tutoring package or the hourly rate for tutoring. So I'd like to welcome the Patreon members. You are among the first to be here. And I would like to remind you that I will be going live on Zoom the second and fourth Wednesdays of every month, 9 p.m. Eastern Standard Time. So if you miss the second Wednesday, perhaps you could show up to the fourth Wednesday. So that's what I'm going to do for you every month. I'm going to put up at least 2 videos and have 2 tutoring sessions or Q&A sessions, okay, to help you out with your studies. So let's go over the second question. Hello, welcome back to this tutoring session. I'm your host and tutor, Annalise Garrison. And today, for our critical thinking, ladies and gentlemen, we're going to learn critical thinking skills today. And for today, I know that you guys always want to do airway breathing circulation, Don't do that. That's going to get you in more trouble. Usually it's going to get you to, pick the wrong answer. What I'd rather you do is stable versus unstable. Okay? What makes a person stable? Number 1, if you see the word stable in the question, that person is stable. If you see the word unstable, the person is obviously unstable. So just look for the word stable. That'll tell you if they're stable or not. Okay? Here's some other cues. Number 2, if they were admitted to the hospital greater than 24 hours ago, the patient is stable. If they were admitted less than 24 hours ago, the patient is unstable. Number 3, does the person have a chronic illness versus an acute illness? Right? Does the person have COPD, which is a chronic respiratory condition, versus appendicitis, which happens suddenly, right? Appendicitis would be unstable or acute, right? The COPD would be stable or chronic. So chronic conditions are stable, acute conditions are unstable and should be seen first. You see? This works for who would the nurse see first. Okay? If they are getting local or regional anesthesia, the person is considered stable. All right? If the person is getting general anesthesia, the person is considered unstable. So, who would you see first? Always pick the unstable first. Okay? If you see words like the person is ready for discharge or they're going to be discharged versus newly diagnosed or newly admitted, right? The new stuff would be considered unstable. But if they're going to be discharged or to be discharged or whatever, that's considered stable, right? Now, let's talk about assessment here. Now we can delegate unchanged assessments. We can delegate stable assessments. What makes an assessment stable? If there's no changes from your initial assessment, that person is stable. So unchanged assessment. would be considered stable. If there's any changes from the original assessment, that person would be considered unstable. And if you see expected findings of the diagnosis, that person is stable. If that finding is expected for that particular diagnosis, don't pick that answer, right? You do see the person first if you see unexpected findings of that diagnosis. All right? Now, let's look at an example of what I'm talking about. And remember these points that you see on the screen. Blue is going to be stable. Red is going to be unstable. So stop it here and take a minute to take notes, and then we will go over a question. I'd like to take this opportunity to invite you to join my Patreon page at the link below. We here at Caring for You Tutoring Services do realize that these are trying times that we are living in. We do realize that your finances may be tight. So consider joining the Patreon page for just $30 a month. Now for that $30, you will get at least half-hour to 1 hour long videos on tips, strategies, on how to take the exams, whether you're taking the HESI, the ATI, or the NCLEX. And also every month we will have a theme, whether that theme be prioritization, critical thinking, whatever that theme may be. So please consider joining the link below. That may be an alternative to getting actual tutoring. So now let's take all that I have talked about with stable versus unstable and use that in a question. Let's look at this question. The nurse has been made aware of the following client situations. The nurse should first see the client. A, the 28-year-old client with pneumonia who is expectorating blood-tinged mucus and is reporting chest pain upon inspiration. B, a 36-year-old client with a pulmonary emboli who is receiving prescribed heparin, sodium infusion, and has a PT which is 1.5 times the control value. C, a 40-year-old client with MS who has ectopia and is experiencing urinary incontinence. Or D, a 47-year-old client who just had a thyroidectomy 1 day post-op and is reporting that the dressing feels tight. Now, before we go further, I want to explain that every exam question, no matter what exam you're taking, whether it's the HESI, ATI, or the NCLEX, every exam question just about has an age, a gender, a diagnosis, and the reason you are taking care of that patient phrase. So we'll call that the caring phrase. So let us look at this question, these answers. One thing I want you to know is that the age and the gender does not matter. We are looking at the diagnosis and the caring phrase. Okay? Now let's take all that we have learned with stable versus unstable and apply that to these answers. Let's look at answer number 1. A 20-year-old client with pneumonia who is expectorating blood-tinged mucus and is reporting pain upon inspiration. All right, this person is not stable because they are expectorating blood-tinged mucus, and they are reporting pain upon inspiration. So, although they're not stable, if a person has pneumonia, is this an expected finding of pneumonia or an unexpected finding of pneumonia? And for those of you who have tutored, I've said that 7 out of 10 times pain is not the answer on the NCLEX unless we cause the pain, unless the medical profession caused the pain. So, this is an expected finding of pneumonia, right? Therefore, we do not pick it. Remember that if it is an expected finding, it is a stable individual. All right. A 36-year-old client with pulmonary embolism, that's your diagnosis, but the reason we're caring for this person is who is receiving prescribed heparin sodium infusion and has a PT which is 1.5 times the control value. So we are caring for this person's infusion. The question is the PT an expected finding or a non-expected finding? It is an expected finding. So, what does that make this person? That makes this person stable. We are caring for the heparin infusion. Now, if anything went wrong with the heparin infusion, we would need to see this individual first. But, given the information that we have, there's nothing wrong with the heparin infusion at this point in time. Therefore, don't pick the answer because the PT is normal. A normal value for this individual. Okay? Let's look at C. A 40-year-old client with MS who has ectopia and is experiencing urinary incontinence. Now, MS is the diagnosis. Is that a stable condition or an unstable condition? MS is a chronic condition, so this would be a stable condition, right? Versus the pneumonia, which is unstable, right? It's unstable because pneumonia is not a chronic condition. MS is a chronic condition. So, people with MS usually do have trouble with their kidneys, don't they? Right? So, because MS is a chronic condition, don't pick it. We want to pick the most unstable individual first in this case. Let's look at D. A 47-year-old client, okay, that's the age, we don't need to pay attention to the age, who just had a thyroidectomy 1 day post-op. So, thyroidectomy, that is not a chronic illness, right? So, a thyroidectomy 1 day post-op and is reporting that the dressing feels tight. Okay, this person had a thyroidectomy what? 1 day ago, 24 hours ago. So this person should be stable, right? But is it normal for the dressing to feel tight 1 day post-op? No, this is a unexpected finding. So since this is a unexpected finding, this person needs to be checked first. All right? Now let's go over the answers again. We did not pick A because for pneumonia, it isn't expected they have pneumonia. So this is an expected finding, and of course they're going to have pain. Pain is an expected finding with pneumonia. Don't pick it. A 36-year-old with a pulmonary emboli who was receiving prescribed heparin, sodium infusion, and the PT, and has a PT which is 1 1/2 times the control value. This is an expected finding with somebody who is receiving heparin. A 40-year-old client with MS who has ectopia. Ectopia, what's ectopia? A displaced organ, right? This is something chronic. So if their kidney is displaced, of course they're going to have kidney problems. This is an expected finding. So we want to check on D because the dressing feels tight should not be happening. A tight dressing could be a sign of that the morning nurse just put the dressing on too tight. Simple as that. Or it could be an infection. So let's check the dressing. All right, very good. Now, for those of you who joined my Patreon page, I'm going to continue on for another 45 minutes. Let's look at the next question. The nurse has been made aware of the following client situations. The nurse should first assess the client who is being treated for gastro bleeding and is reporting having tarry stool, has not voided since an indwelling catheter was Let's do the second question. The nurse has been made aware of the following client situations. The nurse should first assess the client who is being treated for gastrointestinal bleeding and is reporting having tarry stool, has not voided since an indwelling catheter was removed 6 hours ago, is confused and has unfastened the prescribed vest restraint to go to the bathroom, or D, has not had a bowel movement since a prescribed oil retention enema was given an hour ago. Now, let's think about stable versus unstable. The question is, the nurse should first assess the client who. All right. So is being treated for gastrointestinal bleeding. So this person is already being treated. Okay? And never pick the expected symptom, right? So, and is reporting having tarry stool. That's a symptom of the disease, correct? So don't pick that answer. Has not voided since an indwelling catheter was removed 6 hours ago. Okay? We'll think about that because 6 hours is less than 12. So remember, if a person is admitted less than 12 hours, they are acute. Look at C. Is confused and has unfastened the prescribed vest restraint to go to the bathroom. Okay, this person is confused and has a prescribed vest restraint on for a reason. So this is a safety issue, ladies and gentlemen. A safety issue. Safety always comes first, right? For those of you who I am tutoring, safety is first, then neurological issues, then physiological issues, and then psychosocial issues. So, let's look at D. has not had a bowel movement since prescribed oil retention enema was given an hour ago. Okay, that is a unstable condition because an hour is less than 12 hours, right? It was given an hour ago. So B is unstable, C is unstable, and D is unstable. But what answer would we pick? We would pick C because safety is always first. You see? All right. Let's look at question number 3. The nurse has received the following information about assigned clients. The nurse should first assess the client with ulcerative colitis who is reporting having bloody diarrhea. Okay. Do not pick the expected symptom of the disease, of the illness. Right? So A is a symptom of the disease. Don't pick it. With lung cancer who is reporting expiratory rust-colored sputum, unfortunately, this person has lung cancer. This is a symptom of lung cancer. Don't pick it. Who had a PTA 4 hours ago and is reporting flank pain? Okay, let's keep that one. Who had a thyroidectomy 3 hours ago and is reporting incisional pain at a level of 6 on a scale of 0 to 10. Okay. So, this person had a PTA 4 hours ago and a thyroidectomy 3 hours ago. They're both unstable. But who is having the most recent unstable problem? 3 hours ago, right? So pick D. Not only because 3 hours comes before 4 hours, but also because this pain level has a level and a scale. C just has flank pain. So if you have to pick between two pain answers, always pick the level and the scale. But if I'm tutoring you, we've already discussed that pain is a psychosocial issue that 7 out of 10 times you don't pick. So you have to, hold back on picking pain. 7 out of 10 times pain is not the answer. But with this question, 2 answers had pain in them. So if you have to pick between 2 answers, always pick the level and the scale. Okay? All right, that was question number 3. Let's try question number 4. The home health nurse is assigned to the following clients who live within 3 miles of each other. The nurse should first assess the client who has a PEG tube whose family member will administer the first feeding, B, a central venous access device for chemotherapy and is reporting burning upon urination, C, a pressure ulcer and is reporting that the hydrochloride dressing has fallen off, or D, a transverse colonoscopy and will be changing the colostomy bag for the first time today. Interesting question, because this is home health. So let's look at them one at a time. A PEG tube whose family member will administer the first feeding. Let me give you a piece of advice when it comes to home health. Always pick the answer that you, the nurse, need help with. You, the nurse, need help with, not the family. Okay? You're the nurse. So you will be helping them. They're looking to you for help. You are that family's helper when you're doing home health. So always pick the answer that you need help with. Okay? As a nurse, let's think about this question. As a nurse, are you going to need help with showing someone how to administer a PEG feeding? Are you personally going to need help with that as the nurse? No, you should know how to do that. The family is looking to you for guidance. right? You don't need assistance with the peg tube feeding, right? A pressure stage 1 ulcer who is reporting that the hydrochloride dressing has fallen off. You can show up and put that dressing back on and show the family member how to put a dressing on, right? And furthermore, if you think about this question, this person doesn't even need a dressing on them, right? What's your pressure ulcer stage 1? What are the 4 stages, right? Stage 1 is just redness. Stage 2 is a break in the skin. So if we think about this question even more critically, well, if they have a pressure ulcer stage 1, they don't even need a dressing. It's just redness. Stage 1 is no break in the skin. But let's say you forgot that. And you read the question, pressure stage 1 ulcer, and is reporting that the hydrochloride dressing is falling off. You, as the nurse, do not need help showing a family member how to do a dressing change. Right? So don't pick C because you don't need help. Let's look at D. A transverse colonoscopy and will be changing the colostomy bag for the first time today. Do you, as a nurse, need help showing the family how to change a colostomy bag? No. If they were in the hospital, you would know how to change the colostomy bag, right? So you yourself can tell the family member how to do that, right? So you don't need help with D. But let's look at B. A CVA device for chemotherapy and it's reporting burning upon urination. Why do you need help as the nurse with this patient? Why? What does burning upon urination, what is that a sign of? Right? A urinary tract infection. Very good. I heard my Patreon members shouting in the back. Good job. So you will need to call the doctor, right? That is a change in their assessment, right? That makes the person unstable. They have a CVA access device for chemotherapy, okay? But there's a change. Now there's burning upon urination. When there is a change in the assessment, that makes them unstable and needs to be picked. Plus, you need help with this individual. You're going to have to call the doctor. The doctor's going to say send them to the hospital. They're going to go to the ER. They're going to get antibiotics and sent home and then follow up with the doctor on Monday, right? So we can see that you need help with this patient. And that's why the patient is unstable and needs to be seen first. Let's look at number 5. With prostate cancer, let me read the question. The nurse has received the following information about assigned clients. The nurse should first assess the client. A. With prostate cancer and metastasis who has developed numbness and tingling in the legs. B. Who had a total knee replacement 2 days ago and is reporting pain in the affected knee after physical therapy. C. With COPD who is using pursed lip breathing after taking a shower. Or D. Who had an appendectomy 2 days ago and has not had a bowel movement since surgery. Okay. Stable versus unstable. If they were admitted greater than 24 hours ago, that makes them stable, right? So let's look at B. Who had a total knee replacement 2 days ago. That person should be stable. This happened 2 days ago. So throw B out for that reason 2 days ago. And who had an appendectomy 2 days ago and has not had a bowel movement since surgery. Okay, appendectomy happened 2 days ago. That person can wait. Okay, they've waited for 2 days. So, even if you forgot or don't know that a bowel movement can return after surgery 3 to 5 days, even if you don't know that little tidbit, still this operation happened 2 days ago. So for that reason, we throw out B and we throw out D. Now we're left with A and C. With prostate cancer and metastasis, who develop numbness and tingling in the legs, and COPD using pursed lip breathing. Okay. COPD is chronic. It's usually a chronic illness, COPD. But even if they're having a attack, okay, COPD using pursed lip breathing, that is a symptom of the disease process. Never pick the expected symptom of the illness, right? So we have to pick between A and C. So that's the explanation for C. Let's look at A. With prostate cancer, okay, that also is a chronic illness. But what's happening with A? A change in the assessment, right? With prostate cancer and metastasis, who has developed numbness and tingling in the legs. For those of you who I tutor, I've talked about what? Safety always gets picked first. Neurological issues always get picked second. So this is a neurological issue. Not okay, so if we use stable versus unstable, this is a change in their assessment. They have prostate cancer with metastasis, that's their diagnosis. But the change is they have developed numbness and tingling in the legs. Let's take a look at that. That's the new change in the assessment. So the answer is A. Very good. All right. Question number 6. The nurse has been assigned to the following client situations. The nurse should first assess the client who? A. Had a CVA 48 hours ago and is receiving oxygen at 24% via ventilator mask and has a PaCO2 of 55. B. Open reduction and internal fixation of a left hip fracture 12 hours ago and is reporting incisional pain rated on an 8 on a scale of 1 to 10. C. A chest tube inserted 12 hours ago for a hemothorax and 100 milliliter of dark colored drainage in the collection chamber. Or D. An appendectomy 18 hours ago and has a temperature of 101.5. Who would I pick to see first? Let's look at A. A CVA 2 days ago, all right, and is receiving oxygen via ventilator mask and has a PaCO2 of 55. All right, is that stable or unstable? What is normal PaCO2? In the back. My Patreon in the back. Normal PaCO2 is 45, right? 35 to 45. So the PaCO2 here is high, right? This is not a expected finding of somebody who's receiving oxygen at 24%, right? So this person is unstable. So let's keep it. B. Open reduction internal fixation of a left hip fracture 12 hours ago. Okay, this person is reporting pain. Is pain a normal finding of a fractured hip? Yes. Don't pick the expected finding of the illness. So don't pick B. A chest tube inserted 12 hours ago for hemothorax and 100 milliliters of dark colored drainage in the collection chamber of a closed chest drainage system. Okay? This is an expected finding of someone who has a chest tube. Draining 100 milliliters is not bad. By the way, write this down now that I'm reading this question. You should report if someone has a chest tube and they have drainage of 100 milliliters in an hour. That needs to be reported because that could be a sign of internal bleeding, right? But drainage of 100 milliliters in 12 hours is not bad at all. All right? So, there's nothing wrong with C. That's an expected finding of a chest tube. Right? D, an appendectomy 18 hours ago and has a temperature of 101.5. Now keep in mind, ladies and gentlemen, that we're going to see all of these individuals. The question is, who should the nurse assess first? So it's not like, oh, this person has an appendectomy and he's running a temperature, I'm not even going to look at him. No, that's not what the questions are asking. The questions are asking, who would you assess first? So, don't think to yourself, oh, this person does not need to be seen. They're all going to be seen. It's just that who are we going to look at first? That's what the question is asking us. So in this case, because the person who's receiving oxygen has a unstable finding, right? Normal PaCO2 is 35 to 45, and the PaCO2 is high. That is your answer. Because they had a CVA 48 hours ago and they're receiving oxygen. They should be stable on that oxygen. But the PaCO2 is too high. That's why A is the answer. All right? Good job. I hope this is helpful. Like I said, if you want to interact with me, I'll be on the second Wednesday. So today is 10/3. So it's not the first Wednesday. It's not this Wednesday. It's going to be next Wednesday. Okay, I'll put an announcement up on my YouTube channel and remind you. So that reminds me to tell you, please hit the bell, the notification bell. Subscribe to the channel, hit the notification bell so that you will get a notice that I will be live on Zoom the second and fourth Wednesdays. Okay? That might change in the future. But right now, the second and fourth Wednesdays. Okay? All right. That was what? Question number 5? Or 6? What was that? That was question 6. So, look at your paper. We're on question 7. The nurse is assigned as a preceptor to a newly hired nurse. Which of the following, if performed first by the newly hired nurse, would indicate his or her ability to prioritize? Obtaining a blood glucose level for a client with a history of hyperglycemia who recently returned from surgery. Stable versus unstable. This client is not stable. They recently returned from surgery. Performing a neurological check on a client with primary hypertension who is reporting right-sided weakness. Safety issue. I can tell right there. If they're reporting right-sided weakness, they're at high risk for what? Falls. Safety always comes first. Assessing the pain of a client who had a thyroidectomy 2 hours ago and is reporting a sore throat. Thyroidectomy 2 hours ago, but they're having right-sided weakness now. Checking for the return of a gag reflex of a person who returned from surgery 15 minutes ago from a bronchoscopy and his NPO. Okay, that person, D, is stable. They returned from surgery 15 minutes ago. Of course, when you have a bronchoscopy, you're going to be NPO, right? So there's nothing new about this person's diagnosis. There's no change in their status after surgery. Remember, pick change in status, change in assessment makes the person unstable, and you pick that person first. So D is out because there's no change in their post-surgery assessment, right? So let's throw out D. Let's throw out C, because they just had a thyroidectomy 2 hours ago. So what? So you're going to expect pain. Remember what I said, don't pick pain. 7 out of 10 times pain is not the answer on the NCLEX unless we cause the pain, the medical profession caused the pain, or they have a level and a scale. All right. So let's throw out C because C is a expected finding for this individual who had a thyroidectomy. And let's throw out A because obtaining a blood glucose level for a client with a history of hyperglycemia. Well, that certainly does not take precedence over right-sided weakness, does it? And that person would be, the person is reporting a right-sided weakness now. What is right-sided weakness? Obviously that would put the person at risk for falls if they're having right-sided weakness, right? That's a safety issue. Safety's always first. So the answer for number 2 is B. The answer for number 7 is B. All right, let's look at 8. The nurses received the following information about a signed client. Whom should the nurse assess first? A 66-year-old client with pneumonia and a fever of 100.7. That's A. B, a 56-year-old client who had an abdominal cholecystectomy 12 hours ago and is restless. 12 hours ago. 12 hours or less makes them unstable, right? So let's keep that one. A 43-year-old client with ulcerative colitis who has 4 episodes of blood-tinged diarrhea in 6 hours. 6 hours. Well, 6 hours is more unstable than 12 hours, right? So let's keep that one. A 24-year-old client who had an open reduction and internal fixation of a fractured femur and is requesting a dose of prescribed medication. Well, D is an expected finding of the operation. So they're in pain. They're requesting their pain med. That's an expected finding. So throw D out. Throw A out. a 66-year-old client with pneumonia and has a fever of 100.7. Well, that's an expected finding of pneumonia, don't you think? Uh, the A temperature or a fever is the body's first line of defense to let us know as medical professionals that, hey, there's something not right in here. So, a temperature is an expected finding. Throw that out. So now we're stuck with B and C. A 56-year-old client who had an abdominal cholecystectomy 12 hours ago, or ulcerative colitis with 4 episodes of blood-tinged diarrhea in 6 hours. They're both unstable. 12 hours and 6 hours. Both unstable. But 6 hours gets picked. And if you think about it even further, what happens with somebody who has 4 episodes of blood-tinged diarrhea? Does it say blood-tinged diarrhea? Yeah, 4 episodes of diarrhea in 6 hours. What'll happen? They'll get dehydrated, loss of fluid and electrolytes. If you lose fluid and electrolytes, what happens? You start getting confused. You might even get comatose. So the answer in this case for number 8 is C. You see? You see how wonderful the stable versus unstable is? It's really wonderful, isn't it? That's what I mean about critical thinking. And if you're getting tutoring from me, we do a lot of critical thinking exercises. We discuss what step of the nursing process the question is, and we is talking about, and we write nursing diagnoses for the questions when it's applicable, and we focus on that nursing diagnosis. And if you focus on the nursing process and the nursing diagnosis, you can always pick the right answer. That's what I do in tutoring. I really focus on the critical thinking because that is what the NCLEX is focusing on. The NCLEX in the year 2023, which will be coming up soon, will have a lot of, case study questions. So, I don't focus on case studies just yet, but I do focus on your critical thinking skills in the tutoring sessions. For sure. All right, let's look at question number 9. The nurse has received a change of shift report on the following client. The nurse should first assess the client with sickle cell crisis who had a hemoglobin of 9 grams per deciliter, with pneumonia who has an oral temp of 101.8, who had a femoral phlebitis graft bypass surgery and is reporting slightly more pain than before the surgery, or D, has pneumonia and is expectorating blood and is reporting chest pain upon inspiration. What do you think the answer is? No help. 30 seconds. I hope that we all picked C. All right, let's take a look. With sickle cell crisis, who has a hemoglobin of 9. Okay, that is an expected finding of sickle cell crisis. A hemoglobin of 8 to 10. People with sickle cell usually have a low hemoglobin. Expected finding. So we don't pick A for that reason. C. I'm sorry, let's look at B. Pneumonia has an oral temp. Okay? Don't pick temp. Temp is an expected finding of any illness. Right? Same thing with D. Has pneumonia and is expectorating blood and reporting chest pain upon inspiration. Well, when you have pneumonia, I know that hurts. But pain is an expected finding with pneumonia. All right. So we don't pick D for that reason. Now look at this. Who had a femoral phlebitis graft bypass surgery is reporting slightly more pain than before the surgery. Now I just got done saying don't pick pain. However, they're reporting more pain since they've had the surgery. Now, 7 out of 10 times pain is not the answer, but when we cause the pain, it is the answer. Okay? Now, this person is reporting slightly more pain than before the surgery. They had an assessment. They had surgery. Of course, they're going to be in pain, but they shouldn't be in more pain after surgery than before the surgery. Right? They have surgery to feel better, not worse. For Christ's sakes. Right? So that's why C is the answer with this question. Because we may have possibly caused the pain. Maybe we left a sponge in there or something. Let's check it out. Right? So the answer for number 9 is C. Alright, let's do one more. And I want to thank you very much for becoming a Patreon member today. And we'll talk. Hopefully you'll check out my website. If you would like tutoring, I do have different packages. But, this is a perfectly good alternative as well, so. Okay, last question. The nurse is caring for the following clients. It would be a priority for the nurse to follow up with a client who is scheduled for a renal transplant in 2 hours and has a platelet count of 150,000. Is scheduled for an abdominal perineal resectioning in 1 hour and has a blood urea of 47. Had a left lung lobectomy 8 hours ago and has 200 milliliters of serous sanguineous drainage in the closed chest tube drainage system. Or D, had a right hip replacement 12 hours ago and has drained 60 milliliters of drainage in a closed wound drainage system in the past 2 hours. All right. Let's take everything we have learned as far as stable versus unstable goes and answer this last question. Okay, scheduled for a renal transplant in 2 hours. So that's the future. Right? Alright, now look at this. Is scheduled for an abdominal perineal resectioning in 1 hour and has a blood urea of 47. Now let's look at these labs. A, has a platelet count of 150,000. Okay, we know that platelet counts as 150,000 to 450,000. So A is an expected symptom, right? Is expected. That's normal platelets. There's nothing wrong with A. But look at B. They have a blood urea of 47. What is normal BUN? 10 to 20 or 10 to 25, whatever you want to say. So a BUN of 47 is almost double, is double that, right? So that's not an expected finding. A blood urea nitrogen of 47 is not an expected finding. Keep that in mind. Had a left lobectomy 8 hours ago and is draining 200 milliliters of serous sanguineous drainage. Nothing wrong with that. Expected finding, right? A right hip replacement and is drained 60 milliliters of drainage in a closed wound drainage system. Nothing wrong with that. Expected finding. So what's the unexpected finding? The blood urea nitrogen of 47 is way too high. So the answer to number 10 is... what is B because of the BUN level. Okay? So there you have it. I know this was a great presentation, so you're very welcome. I know you learned a lot, so you are very welcome. All right. I will see you in the next video for the Patreons, or I will definitely see you the second Wednesday, second week. Not this Wednesday, but the next Wednesday. I will put a ad up. I'll put a reminder on my YouTube channel. And I will continue to make these hour-long videos, or almost an hour. I'll continue to make these videos at least twice a month for the Patreon members. Okay? So, mark your calendars. I know you found the Zoom link. I got an email and I left you a message. So, that's good. If you guys want to ask me questions, leave a message. Leave a message on the Patreon page, and I will answer that before the second Wednesday. Okay? All right. It's a pleasure meeting you. I hope this is helpful, and I'll see you. I'll see you in the Zoom conference. Take care and God bless, and good luck in your studies.